The next exercise I'm going to have you do is called a heel slide. What I'm going to use is a belt. You can use the gait belt that you get at the hospital, or a strap, or a long sheet at home. How I'm going to do this is just wrap it around your, and then I tend to like to wrap it underneath the knee, but whatever way is comfortable for you is fine. Then I'm going to give you the straps here. So what I'm going to have you do is kind of pull up with your arms by sliding your heel back and bending that knee as far back as you're able to. Good. And then back on down. This one is very important after the knee surgery in order to get that knee bend. It's going to be painful, especially after surgery. Just push yourself as hard as you can to get that motion back. We'll go ahead and do 10 reps. And I encourage you to use that belt so that way you can use your arm strength more than just relying on the leg strength, because also people tend to get a lot of tightness in the back of their thigh here, which is called your hamstring, and we want to make sure that that muscle is loose so that way you can get the opposite direction, which is the straightening of it. Very good. All right, the next exercise is called a straight leg raise. Mary Kate, what I'm going to have you do is bend your opposite knee for me. That is to help protect the back. What you're going to do is almost like that quad set. You're going to tighten your quad here and push that knee straight into the mat as much as you can, and then I'm going to have you lift your leg up to the level of your other leg. Good. And then back on down. Right after surgery, you might have difficulties doing this one. I've had patients use the belt to kind of help activate that muscle and lift it on up. It's a very important muscle strengthening exercise to help strengthen the front of the hip and that quad muscle, but it is very difficult because you're using that long lever arm here. So this one is a side-to-side hip abduction exercise. What I'm going to have you do is, once again, you can bend your other knee for protection of the back if you'd like. Then same idea, I'm going to have you tighten up that quad muscle, keep that knee nice and straight, and slide it out to the side. Very good. And then back on in. Go ahead and do 10 reps of that. Excellent. The next one's called a longer quad. And what you're going to do is you're going to go ahead and try to straighten your knee as much as you can. Excellent. Try to hold that for 5 seconds. Good. And then bring it back on down. Excellent. One thing to try to do is when you bring that leg on down to go nice and slow and don't just drop that leg down. Excellent. It is also working that quad. So that is a super important exercise to do to help with walking, stairs, and preventing that knee from buckling. I also like to keep that foot pointed up at yourself so that way that activates the quad a little bit more. You might not get the knee completely straight, but just do what you can, because that is also helping that knee to go all the way straight to help with walking. And you might get a stretch in the back of the knee as well. Very good. Thank you so much for watching the video. If you have any questions, please give us a call at Central Peninsula Rehabilitation, 714-4145.